So you've been diagnosed with stress incontinence. So now what's your next steps? Stress incontinence is a weakness in the pelvic floor muscles. And sometimes it's also an anatomic shifting of things in the pelvis. Most of the time that anatomic shifting is related to childbirth, and sometimes with the birth of a child it just can move the bladder or move the uterus, move those pelvic floor structures enough that it causes some issues with incontinence. When I think about stress incontinence, I think about it as mostly a structural change that needs to be improved upon. So when we're trying to improve it, there are several different ways we can do that. One of the best ways that's been shown in lots of research studies is with pelvic floor physical therapy. And at Reedsburg Area Medical Center, we have a great pelvic floor department that can help with their exercises to improve that. Now, I frequently hear that, well, doctor, I already do Kegels. Well, doing Kegels is great and you should continue to do them. But doing Kegels is one specific exercise. Doing Kegels would be like saying, I want to get into a bodybuilding competition, but I'm only gonna do curls with my arms. Well, that's great for your arms, but that doesn't do anything for the rest of your body. So we want to look at the pelvic floor as a whole area that needs attention. And that's where the physical therapy department can help you. And they'll teach you exercises, not just the Kegel exercises, but other exercises that can help you strengthen that pelvic floor so that you can then have better control over your urine. As a result of doing that, you will likely find that you may not need another medication or another treatment or a surgery even, because you have found how to better control your incontinence. Now that doesn't mean that you can do it for 3 months and then just stop doing it. Unfortunately, just like any exercise, you have to continue doing it to maintain the benefits that you're getting out of it. So it's one of those things you have to learn the basics and then you need to practice the basics, just like brushing your teeth. You can't just go to the dentist once every 6 months and expect to not get cavities if you don't do that teeth brushing in between. So we want to continue to do this as a regular thing. Besides the pelvic floor exercises and the physical therapy, another thing that I had alluded to was weight management. And again, with the bladder being at kind of the lowest part of our body, when we cough or sneeze, all of that energy is being transmitted down onto the poor bladder. And so if there's more weight pushing down on that bladder, it's going to have a harder time holding it. So again, it would be beneficial to lose weight. And again, I understand and appreciate that that is not an easy process, but anything you can do, even if it's 10% or 5% of your current weight, you will start to see some benefits with that. So weight loss is also helpful. And then besides the physical therapy and weight loss, there are several other things. There's a device that we can use. This is something that's placed in the office. It's called a pessary. And probably the best way to think about a pessary is similar to a diaphragm or similar to the Nuva ring, if you ever use the Nuva ring. It's an insert that goes in the vagina to help support the bladder. So that can be helpful. There's also some over-the-counter products that do the same thing. There are disposable over-the-counter products that do the same thing to help support the bladder. And you could certainly look into those as well. And there's nothing wrong with using those over a pessary. It's just that those are disposable and a pessary is something that is not disposable and you'd only be able to get in the physician's office. After the pessary, the physical therapy, the weight management, watching your fluid intakes, all of those things are done. If you're still having struggle, there are surgeries that could potentially be done as well to help this. The surgeries are constantly getting improved upon and benefited. You've probably heard of women that have had a bladder lift. Bladder lift is for women who, after childbirth or after possibly other surgeries, their bladder has fallen down into the vagina. That's a fairly common thing, and sometimes if we're able to repair that and push that back up, that can help to give better control of the bladder. The way to think about the bladder falling down is think of it almost like a hernia. There's a weak area within the vaginal wall that's allowing that bladder to drop down in that area. That's one of the areas where smoking, unfortunately, does not help an individual because it can cause their tissue to be a little bit weaker. And so if you do smoke, we certainly would strongly encourage you to quit smoking before you have any surgeries to help improve the support in that area. Another procedure that we frequently do for stress incontinence is something called a sling procedure, or a TVT is another name for it, called transvaginal taping. And basically what this is it's placing a piece of mesh underneath the urethra. So if your urethra is coming out of the bladder like this, the mesh is kind of like a U shape, and it kind of comes underneath that tube so that when you cough or sneeze, it kind of bumps up against that tube to cause that tube to get compressed just a little bit so that you don't have the leaking. That option has been around for, I bet, 25 to 30 years in different ways. It's considered a very safe option, but it's not an option for everybody. There's certain people that wouldn't be as good of candidates for that, but it's definitely shown to have a 90% improvement in the amount of leaking, even when we look at women 5 years after the sling has been placed. So it's something that it doesn't just work for a short period of time, it keeps working for years and years down the road. So that's a nice option to have. Another slightly newer option is a colloid injection that goes into the urethra. So the urethra is the tube that comes out of your bladder, and at the top of the urethra, where it connects to the bladder, there's a sphincter in that area that's supposed to keep your bladder tightly closed. But in some women, that sphincter gets a little bit weak, and so it stays a little bit open, and so can lead to some of this incontinence. Well, we've all heard of the movie stars that get their lips injected with colloid to have more full lips. Well, they have designed some collagens or colloids that can be injected near that sphincter that help to close that sphincter a little bit more tightly. And in fact, in the Netherlands, that's one of the first treatments that they do for stress incontinence after all the behavioral things. So that is a newer but not new treatment for women, and I think that you're going to see that happening much more frequently in the very near future. So I think with those treatments, there are definitely things that can make your quality of life better, and that's really what we're focusing on, is how to make your quality of life better so that you can do the things that you want to do. You can chase after your kids or your grandkids. You can maybe even consider going on the trampoline, but I know that's a tough one for some people. But these are the things that we want to continue to focus on to try and help you live your best life. So that is a summary of stress incontinence.